I need to change my life, bro.
Hi Terry, how you doing?
Hey,
Sorry about that.
How you doing?
Yeah, you doing alright?
Yeah, doing pretty good. Trying to.
What do you have here? Questions for me?
My little 4 questions for you before I leave today.
Shoot, let me hear the questions.
Well, I don't know. I think I better ask you before. Last time I was here, I saw what was her name? Shorter.
Shorter, yeah.
Yeah, and I forgot to ask her any kind of question. Well, the first one is weight limit.
Like how much you can lift?
Yeah.
So I have a question for you before that. Did you do the rehab? Did you go to the cardiac rehab?
Man, I'm still trying to get in there, bro. I hadn't been yet. I told the lady, she's been calling the house like crazy, you know, and I keep telling her I'm gonna go, you know, but she now back to work and you know, trying to. I work 12-hour shifts.
Yeah. So I think from a heart perspective, there's no real weight limit that you have. You just have to sort of go with your symptom. Are you having chest pain at all?
No, I've been feeling pretty good. But see, the thing about my work is I'm in the textile industry over at Santee Print. We have those big rolls of cloth and they 500 yards.
Right.
And it takes one guy, you put a bar in it and one guy lifts one end and the roll weighs 300 pounds, you know?
Right. So this is my thing, right? This is why I think it's important for you to get into the rehab. I know you started back work and it may be difficult.
Yeah.
But that sort of tells you how much you can do. So there's no, if you feel good and you have no chest pain, then you could do everything you want to do. People get stents and then they go run a marathon. It's not, you know. So if you have no chest pain and you're doing good, I don't want to limit you from a physical activity. You know, I want you to live a normal life. Okay. So I don't. It's difficult for me. I wouldn't put a weight limit on you. I know it's tough. I don't know if you speak to your employer. Is there a way for you to do less? Is that?
Well, they got me doing less now. They got me running a machine, you know, and because my manager, he's had 4 stents put in himself. He's like 64, you know. But as soon as I got back, he like, no, I'm not gonna have you lifting anything, you know, and stuff like that. So they got me doing a different job right now. But I just don't feel comfortable. I know what you're saying about the activity and everything, but I don't feel comfortable lifting 150 pounds, you know.
I get it, and this is why I think one of the best attributes of the rehab is when you complete the rehab, you feel better about it. You know, most people who've had a heart attack, you know, it's a little bit of PTSD. You know, you're kind of afraid to do something.
Well, I am. I even around the house, I got my son doing everything, lifting everything, even now, you know, and I'm like.
And in rehab, sometimes it seems stupid because you feel good and, you know, but the rehab really, I think it helps with that mindset. When you complete the rehab, you see how much you can do. You know, you exercise and stuff in a supervised manner, and then you leave rehab and you're like, okay, I'm good. I can do all these things. So that's why I really push for the rehab.
Yeah, because see, before all this even happened to me, I was real active. You know, you could never get me to slow down.
Yeah, but we want to keep it that way.
Yeah,
we want to keep you active.
But now it's like I move like a little, you know.
Yeah. So try and do the rehab, okay?
Yeah.
Contact them and
I'll call that lady back and
But I think it's 2 days a week now. And even if you could do 1 day a week, I know it's like, don't tell them that, but you know what I mean? Like if you could do, even if you do start it and do half of it, and you know, just to get that mental aspect of it. Okay?
Yeah, it's definitely affected me since I had it, as far as my activity and the way I look at life now. I mean, it's changed a lot,
Definitely. You know. I mean, it's a life-changing event, you know. But you got good results with the stents. You don't have chest pain. Your echocardiogram that you did look good.
Well, I was going to ask you about that because I think I came in last Friday and had that done, you know.
So a good squeeze, looks good. I mean, your heart functions good. So there's no reason that you should be limited. If you feel good, your heart's pumping good.
Yeah.
So you should have no limitations in that regard, okay? Right.
Well, one other thing is, well, I just talked to the nurse. She said you had me on 90 days. I told her, like, when I get my medicine refilled, I need 90-day supplies. But she said all of them was 90 days already, except the blood thin. I mean, the bill of what you call it?
Brilinta.
Yeah, I got to go get that. Pick that up.
I just sent it.
Okay.
I just sent it, yeah.
Yeah, I'm going to pick that up when I leave here.
Cholesterol, we're checking today.
Yeah, what was my number on it? Because I hadn't had a number since I got out of the hospital.
Right, we're checking it today.
Okay.
You haven't had a check since you left the hospital.
No.
But you've been on the medication, so we're going to check it today. That's the plan.
Okay, and the last one is, when I was talking to, when I came in here, the lady, Miss Shorter, she said something, I don't know, she was looking at the screen up there, you know, about where they put the stents at. I might have misunderstood her, but she said something about there on the right side of my heart, there's like some stop up or something on one of the arteries or something like that.
Let's see.
And it caught my attention, you know, and I'm like, well, I got to ask about that, because it wasn't nothing major. It's like she said she saw a note. But they didn't say anything to me about that up there at the hospital.
You may have implied that there might be some plaque on the right side, but
yeah, I think that's what she was saying, you know.
But maybe it wasn't severe enough to fix. Let's see.
I need because I need to keep my eye on that, you know, because I wasn't aware of none of that.
Well, I mean, that's also why we're, you know, making sure your blood pressure is good and cholesterol and so forth. Let's see.
They gave me this little card here where they put the stents at, you know. But he told me everything was on the left side of my heart.
Yeah, so there's like a 10 to 20% plaque on the right side, but that's mild. That's mild.
Okay.
Okay, so you do have some plaque on the right side.
But as long as I keep my cholesterol down,
that's the goal. We keep your blood pressure down, we keep you active, we get you to rehab, you know, all of these things we're doing is to prevent that from progressing, okay? Eating healthy and so forth. But no, it was 10 to 20%. We don't put stents in until something is 70% or more. So this is mild, okay? And let me see if I could actually, let me see if I can pull the pictures up there.
Yeah, I felt before all this happened, I didn't really have no signs, but I had I felt sluggish a lot, you know. But now I feel like I do have more energy. That's the thing you did last week.
So so there was one blockage right here. You see that? This area right here. Let me see. So you see how this is normal? That's normal. And then this area right here is a blockage. You see the difference there?
Yeah.
Right? So that's one thing they fixed here. I'll show you after.
So is that where they put the stent at?
Correct, yeah. Correct.
Okay.
So we had two little areas. You had this little area here as well. You see that?
Yeah.
So there were two areas. And this is the right side. You see, it looks pretty good. 10-20% is like mild bumps. But, you know, like right here, maybe there's a little... But this is your right side. It looks very good. Okay? So I wouldn't worry about that right side.
Yeah, I changed my diet and everything.
Good.
Since I laid off the saw, I started to eat a lot of...
So this is the
eat
food.
red meat like that no more.
So you see, that was your first blockage. You see, put the stent in, how different it looks?
Does it show the stent is in there?
Yeah, you can see, you can... Let me see.
Well, you know more about what you're looking at than I do.
Yeah.
I just see a bunch
this,
of veins.
You see
know?
this right here? You
Yeah.
kind of see an outline right here? That's the stent.
Oh, okay.
Yeah, it's very faint, but you can see it. See it right there? This is where the stent is.
Okay.
Focus right there. See the stent?
Yeah.
Right?
Yeah,
That's the first stent, and then he went and did the... This is the second area, that little area I showed you. But he fixed that as well. So you got two little stents, see?
Yeah.
Yeah, so you did a good job. Everything's open. Everything looks good. The key for you, my friend, is just to reduce those risk factors. No smoking, keep you active, you know, fixing cholesterol and so forth, okay?
Yeah, I quit smoking years ago. I got married in 92 and I quit smoking in 94.
Yeah, okay. So
my wife, she's like, you know, you need to quit smoking. I quit cold turkey.
So I'm going to set you up to come see me again in 3 months, okay? Just for a checkup. Hopefully you get into the rehab, okay?
Yeah, I'm going to call, I called them back today.
Okay.
And I'll make sure I get in there, you know.
Good. And
I just got back to work, and I've been back to work probably about 4 weeks now, and I've been like trying to focus on getting everything straightened again. You know, it threw me back a little bit on my bills, you know, and stuff like that. And
it's a big deal. I mean, financially, emotionally, physically.
Yeah.
You know, you just have to, you know, stick with your family, keep living a healthy lifestyle.
That's right.
From the activity standpoint, obviously, if you can't do certain things, we'll talk to your employer, you know. But I think the rehab will help you a lot, okay? So hang tight, they're going to come check your blood for the cholesterol, okay?
Okay.
And if it's still a bit off, I'll give you a call and let you know what to change or if we need to add something, okay?
Okay, then.
All right,
Thank you, too.
Yeah, you're doing good, man. Don't worry. You're doing good.
Thank you, too. Have a good day.
Yeah, you too.